I'm pleased to be here today to represent the Utah Nurses Association. We are the voice of registered nurses across the state. Our mission is to educate and advocate for nurses and the profession. Nurses are guided in practice by the American Nurses Association Code of Ethics for Nurses, the Utah Nurse Practice Act, employer policies, and the principles of evidence-based practice. The Code of Ethics for Nurses requires us to be patient advocates, which then demands that we speak for the patient who cannot speak for him or herself. The video of Nurse Alex Bubbles being arrested by a Salt Lake City police officer was just as alarming to us as it was to the general public. Alex was advocating for her unconscious patient as her professional code of ethics demands and as directed by her nursing supervisors. Further, her actions were completely consistent with established policy within her hospital. Following the incident, Salt Lake City Police Chief Mike Brown contacted the Utah Nurses Association to seek our input on a policy that would guide his officers when they are in a hospital as part of their police duties. We greatly value this opportunity to collaborate with the Salt Lake City Police Department and to develop a policy that clarifies the work of the police and helps nurses who provide direct care to patients know what to anticipate when working with law enforcement and their inquiries when they're in their hospitals. We believe that this policy will provide guidance for both groups of professionals, enhancing our teamwork between law enforcement and nursing. And it will help provide the best care for our patients. I look forward to ongoing collaborations with the police department here in Salt Lake City and other departments across the state to improve our professional partnerships.
Thank you, Amy. You know, oftentimes, probably almost every time somebody goes to a hospital or has to go to an emergency room, it's not on the best of terms. It's not their best day. And many, many times when we interact with folks, it's the worst day that they're having. So you can see the profession of being a police officer and a nurse, they're very much the same. We are cut from the same cloth. We really are. You didn't get into nursing and you don't become a police officer to get rich. This is a profession of love and service. And you may find a very loving bond between officers and nurses and medical professionals, because our job at times is very dangerous. And if we're ever hurt, we know that it's going to be into their hands, a nurse or a medical professional that is going to nurse us back or help us heal our wounds. And we very much appreciate that. In the last month or so, I have visited every hospital in the city and several in the county. And I want to reiterate that the women and men of the Salt Lake City Police Department respond to these hospitals and interact with nurses and medical staff thousands of times a month, I'm sure. And they are professional, and they are supported, and they're great interactions. And I want to thank the law enforcement officers of the Salt Lake City Police Department for that, and those across the county. Amy, thanks for your words. And thank you very much for the opportunity to sit down with you and your board to have some tough conversations. I appreciate that. And out of these conversations, we have come up with a new policy and a new protocol that will ensure the positive interactions that we see daily, monthly, yearly between law enforcement and nursing professionals. I want to thank Chief Kevin Thacker for being here from the VPA. And I'm going to turn the time over to Kevin and let him explain his role and how we are going to roll this policy out on a county-wide basis. So thank you very much.
Thank you. I appreciate the opportunity to be here. You know, we deal with hospitals on a regular basis in our job, and things go really well until they don't. And this was a tough call because it's for Salt Lake City, because it's something we've all dealt with on a regular basis, like I say. I represent the chiefs in the Salt Lake Valley here through the Valley Police Chiefs. And when they put together the policy, when Salt Lake City put together their draft policy, we sent it out to all of our chiefs in the Valley, and then brought it before them in a meeting after they had time to review it and kind of soak it all in. I think I can speak for probably all of the chiefs when I say that this is something that you'll see implemented in most of the departments around the Valley, if not further stretching than that. It's one of those things that you really don't think you're going to have as a written policy on some of these, but as things happen, you find you have to do that. And Salt Lake City has worked very hard with a lot of different people to try to put together a policy that will not only work for the University of Utah, but for all the other hospitals in the Valley here. So we support what they're doing. Like I say, this policy will be implemented in many agencies, at least verbally said so through the meetings we've had. And I'm sure it will happen because none of us want to be in this position again. And I think I can say that for both the police community and the nursing community, that we don't want to go through this again. So you will see those changes coming about that will just lay out per policy what should be done in these types of situations. So we support Salt Lake City in this and are grateful for the opportunity to be here. So thank you.
We'll take a few questions.
Chief, there was already a policy worked out, right, between the city police and University of Utah Hospital, correct?
Correct.
The officers didn't adhere to the agreement. So to me, it seems like training might be an issue. How do you make sure that your officers are going to listen to this agreement?
I think you're talking about a blood draw policy.
Okay.
This is a policy of how we will respond, and we will check in, and how we will interact with those that are working within an emergency room and those that are on the inpatient part of the hospital. They're completely different. Yeah.
So how does this compare to the policy that was created with the University of Utah as far as having a nurse supervisor who was the intermediary between the police and the nursing staff?
It's very much, it's very close to that one. We were involved very much with helping draft that first policy with the University of Utah also. But really, the crutch of this whole policy is that when we respond to an emergency room, law enforcement, when you walk through the front door of an emergency room, there's typically security there and or a police officer. We will check in with security. We'll let the staffing, the police officer know that we're there. And then, most importantly, we'll let the charge nurse know, who is running that emergency room, that we're here and that, you know, kind of what the situation is that brings us to the hospital at that time. And then for the outpatient, inpatient, if we go anywhere outside of the emergency room, we will contact the house supervisor, who will then arrange anything we may need to talk to a patient that's in inpatient care.
So before this, there wasn't any written policy, it was more of just...
Yeah, no, it's just like Chief Thacker said, it's all good until it's not. And that's the thing I wanted to reinforce. We've had thousands and thousands of interactions. In fact, when I met with the hospitals, many of the CEOs and their administration says we have great interaction with the Salt Lake City Police Department. But this just gives us all a foundational type policy that kind of spells out how we're going to interact, and more importantly, the courtesy of checking in and kind of letting people know what we're doing and why we're there.
So in Lovell's case, can we infer that there was some miscommunication there, that there was confusion as to where that officer should or should not have been, and that kind of thing?
I'm sorry, I can't speak to that right now.
Did this policy come out of specifically come out of what happened, I guess.
Yeah, no, there's no doubt about it. Yeah, we wanted to, I mean, we wanted to make sure, because at first there was a rift. I mean, there were some hurt feelings on both sides, and for many, many years, as long as I've been in law enforcement, 27 years, I've always looked to nurses and hospital staff as we're on the same team here. And so this just reinsures and emphasizes a very positive interaction with the hospital, the nurses, the staff, every time we go there.
So this applies to all police officers or police departments in the valley can voluntarily adopt this?
Yeah, I mean, and to Chief Thacker's credit, we went to the VPA, he put it out, and I think it was unanimous. I think everybody came back and said, this is a very good policy and something that they would adopt. And I think some of the chiefs have reached out to the hospitals in their jurisdiction to see if they would together voluntarily agree to this type of policy.
How are the hospitals involved in this policy? We know the Nurses Association is, but are the hospitals stepping up as well?
Well, they have been very supportive. Like I say, I've been to every hospital in this city, the VA, the University Hospital, LDS Hospital, Salt Lake Regional Hospital, St. Mark's Hospital, and IHC. I've sat in the boardrooms with their administrative staffs and explained this policy, and they have been very supportive of it. Yes, sir.
Regardless, it will be the police officers who will act within that policy, whether the hospitals, I imagine, don't have to really necessarily adopt it.
No, but you know, it's good common ground. It's very respectful ground that they looked at it and they said, yeah, this is something we could very much support.
What about the cases outside of Salt Lake County? Because in this case, for Nurse Locals, you guys are assisting another department in Cache County. Are you guys speaking to the other agencies in Utah State?
You know, I haven't had a chance to talk with Chief Tom Ross, who's the president of the Utah Chiefs Association, but it's something I would love to have that conversation to see if this isn't a model with the support of the UNA, the Utah Nurses Association, that we could roll this out across the state.
Detective Payne was released yesterday, but does that end the investigation, or is there more that you still need to do?
No, as far as the Salt Lake City Police Department, as an investigation, we have concluded. One more question.
Why have a policy change if you have thousands of interactions a month that are positive, and you've never had a problem like this before, and you've said you never thought you'd have to write a policy like this? Why have a direct... I mean, no, you need to turn. Why have a policy change when you've reviewed the single case? There's been a punishment for this case that I think, you know, however you feel about the punishment, there has been a punishment made. Why do you have to write a new rule for something that there's never been a problem for except for once, and when there was a problem, it was dealt with, and there was a punishment to do that?
I think because, first of all, policies are constantly under review, and practices are constantly under review. Your practices is what normally happens. Your policy is what guides your practices, hopefully. We found, when I started in law enforcement, and I've been here almost 35 years, we had a policy manual that was about this thick. Now our policy manual is 500 pages, 500 and something pages. You find that as you go on, that you have to have some written policies in place so that, one, when these types of things do happen, you have something to fall back on. And two, so that the officers and the employees have something that they can look to for guidance. It's an ever-changing world we live in, and so many things have changed that we didn't ever think we'd have to have policies for that now we have to have policies for. Pursuit is a prime example. You know, we always had pursuit policies that said you couldn't go over 10 miles, you know, all kinds of different things on speed and everything else. Now most agencies don't even allow pursuits because the world has changed, except in very specific circumstances. And I think this is just one more way to give the officers and the employees some direction in how to handle these situations so we don't have something happen like this. But in the case that it does, if it does happen again, the administration has something to fall back on as well. So.
Well, Amy, could we just add, and I think we've kind of addressed this, but would you look at sort of the bravery of Nurse Locals, and I mean, that was an intense amount of pressure that she was facing that day.
Absolutely.
She thoughts when you look at what she faced and how she handled it?
So I'm very proud of Alex, and we stand behind Alex, absolutely. She did absolutely the right thing. Advocating for our patients is fundamental to nursing. It's at our core. It's what we do. So when the chief reached out to us, we said, okay. And personally, just like some of you, well, what do we need another policy for? In my opinion, another policy here is to give nurses a little reassurance that they now have a strict plan. And with that plan, the intent of the plan is that nurses will not leave the hospital in handcuffs because they're protecting their patients.
Had you ever seen a need for a policy similar to this before the Nurse Levels incident? Have you ever heard kind of calls for something that's a little bit more concrete?
Anecdotally, I can only tell you that as nurses, we have experiences, and when something like this happens, those experiences come out of the woodwork, right? So we certainly have heard anecdotally that this is not a thing that has never happened before sort of thing. I don't have specific instances for you, but I would say, you know, when we were discussing it, this incident happened on body cam. This incident hit social media. That's why it was noticed. So we don't know, right? We don't know how many times something happened before.
But you are hearing that there are examples?
I have heard from a few. I have. I can tell you personally, I've worked with law enforcement as a nurse. I worked in juvenile justice. I currently work in an emergency room as a case manager. Work with law enforcement all the time. Plenty of very respectful interactions, even when we didn't agree. At juvenile justice, there were times I didn't agree with the police officer that brought in somebody, but we would have a respectful, professional discussion. And it never ended in somebody being drugged out.